Welcome back. It's a beautiful day. I'm Dominic Chianese, here to bring you more ideas on teamwork in a high-quality nursing home. And I'm reporting from the Library of Forest Hills of D.C. with my co-host, Dr. Alice Bonner from Advancing Excellence. Alice, how are you today?
I'm doing well, thanks. How are you?
I'm fine. What are we going to talk about today?
Well, today I'm going to show you a picture. Ready? Mm-hmm. Take a look.
Wow. What is that? It's really ugly stuff. That's bad stuff.
That is Clostridium difficile.
Clostridium?
Difficile.
Sounds like an Italian song. Clostridium difficile.
It's actually a bacterium that lives in your gut, but it can get out of control and cause a lot of problems, and it can really kind of run rampant in healthcare facilities.
I would think so.
All right, Dominic, I'll see you later.
Okay.
So what do you do when an infection gets out of hand? How do you identify the cause? How do you contain it? How do you prevent the next case or cases? Certainly, we can put up more posters about hand washing, and that may help some, but that's not going to be enough. This episode is about leadership, taking initiative, and pulling the whole team together to prevent infections. Let's start in the most likely place, the restroom.
Mr. Anderson?
I'm here.
Are you okay? It's been 15 minutes.
I just need to sit here.
Oh, okay.
Mr. Anderson has CDI. People with C. diff can have diarrhea almost continuously, with abdominal pain and fever. It can even lead to death. It used to be that most CDI occurred in hospitals, but now over 75% of C. diff infections are first identified outside of the hospital setting. Now it's actually nursing homes that are among the most common places where C. diff infections can happen, and rates are rising. Nursing home residents are at increased risk for developing infections, and of course, proper and frequent hand washing is the primary preventive measure. And for all of us, we want to understand how C. diff is spread so that we can prevent the spread. And that has to do with some of the direct care activities, as well as things like handling linens and laundry. For nursing home leadership, having a system to track CDI has become more important than ever. With data, you can see where your infections are increasing or decreasing, in which units, and then take action accordingly. With risk reduction strategies that are evidence-based, you can more accurately address proper implementation of standard and contact precautions and environmental aspects of care processes. You have been working with the rest of the team on entering data on the Advancing Excellence tool for infections. Can you talk a little bit about how you do that?
Sure. The first time in looking at this, it was a little bit overwhelming, but several of us sat down and we just figured out kind of what information we needed to put in, and then we're kind of taking turns in entering the data, and there's tips on here so that we can download like the list of residents, but then when a new resident comes in, they're added to this just to have them in the database. But we only are having to track the people that actually get C. diff.
So how often are you doing this?
We've been looking at the data and trying to make sure that we enter it every month.
But sometimes the best of intentions doesn't ensure continuous success.
But there's this huge period here where there was no reporting.
So this is something that happens in a lot of nursing homes. There's a quality improvement initiative, but then after time, the documentation starts to falter. So how does leadership step in and correct that? First, they can walk the walk, enter data themselves, learn what the challenges are firsthand. How much time does it really take? This helps to earn the trust of their staff. Leaders can designate a champion for clinical improvement and data entry. Go unit by unit, getting each staff person on board. Ask everyone to get involved, residents, families, and direct care staff. And when all this effort yields real results,
It looks like we're back on track and data's being entered.
They reward their staff for a job well done.
We have some gift certificates for your team, for the CNAs, and we have some special things for nursing too, but the CNAs have really stepped up. You guys have been phenomenal.
When you use this tool, you're potentially not just helping your own nursing home. The same data can also be shared with the Centers for Disease Control in Atlanta, using their system that is compatible with Advancing Excellence.
Together, CDC and AE developed the infection tracking tool to help facilities learn how to collect data in a way that is compatible with the CDC's National Healthcare Safety Network, or NHSN. NHSN is a system which collects infection data from long-term care facilities all across the country. As more nursing homes submit data into NHSN, CDC will be able to provide benchmarks for facilities tracking C. diff and show the national progress on preventing these infections in long-term care. Thank you for taking the time to track C. diff infections and for helping inform our quality improvement efforts.
Clostridium difficile, non qua più malvento, su un tavolo, poi nell'intestino. Clostridium difficile, non qua più malvento, su un tavolo, poi nell'intestino. Advancing excellence, making nursing homes better places to live, work, and visit.